All righty, welcome to the town meeting talk show for Tuesday. What day is it? I don't know what day it is. Thursday. It's Thursday, June the 4th, I think. Yeah, that's what my watch says. Glad to have you with us. The meat of the program today will be playing, for anybody who missed it, the teleconference held by the governor and his staff. Commissioner Crum, Dr. Zink was there, and I think one or two other people, speaking to kind of the big news in the state, and that is the coming changes to the out-of-state travel mandate. That's Mandate 10. They're looking to modify that some and change it to, instead of it just being the mandatory 14-day quarantine, to give people who would like an option or an alternative to that the choice to be tested before coming in. And again, rather than elaborate on that, we'll just let the teleconference or the press conference speak for itself. And then after that's done, that's about 45 minutes of content. We chopped it down a little bit to keep the pieces of that relevant to the travel mandate and things that Cordova might be interested in. And then after that's done, we'll share with you an announcement from DOT about mitigation efforts that are being implemented on the ferries. Not that impacts us for a while, but we'll let that sit where it sits and just give you an idea of what they have going on. That'll be when we wrap up. Town meeting, of course, brought to you by Cordova Wireless Communications, your local cell phone provider. Keeping those dollars that we spend on wireless services in town, they don't go outside the borders of our community to be utilized elsewhere. They stay here, they circulate through our economy, and when you combine that with the millions that Cordova Wireless and CTC together bring in, that's a very powerful economic engine for us. And to have their support for this show is very much appreciated. This show, by the way, will get put on our YouTube channel, of course, youtube.com/Cordova TV, shortly after we're done on the radio here. And I would point out, I expect we'll be speaking with the mayor, Dr. Sanders, possibly later today, possibly tomorrow, but soon, to get some feedback on the local mitigation expert perspective on what some of these proposed changes to this out-of-state travel mandate mean. Obviously, people here have been very concerned about that aspect of this whole thing. Cordova, as Mayor Copeland mentioned yesterday, Cordova does have that 10-day window in place in its emergency order to consider things, although it was also made pretty clear that if Cordova has different rules, that it would be very difficult to communicate those more than likely to potential travelers. And it'll be interesting to see how the state responds, because in some cases the state has said, go ahead and make your own rules, and then in other cases they've been pretty specific that that's going to cause chaos. And I mean, so for example, if somebody's coming in from wherever they're coming in, Seattle, Oregon, Texas, Dubuque, flying to Alaska, and they hear about this business of you can't come to Alaska unless you either agree to quarantine for 14 days or produce a negative test result. And then they arrive in Cordova, and Cordova has a rule that the quarantine is mandatory. I mean, that would make heads explode. So I don't know. The point is, it's very hard to tell at the time of this show how the Cordova emergency response folks are going to respond to this. But those are conversations that I'm hoping to have very soon with the mayor and Dr. Sanders and anybody else. So that's definitely on the radar. But in the meantime, let's listen to what was said last night in the statewide press briefing, including questions from various members of the press, which were germane to Cordova's interests. And then after this, in about 45 minutes or so, we'll come back and take a look at what the Marine Highway has planned. So we hope you benefit from this, and we'll turn things over to the governor and his staff.
We're one of only 2 states in the country that have restrictions and advisories on our travel, the other being Hawaii. All the other states do not, for obvious reasons. They're all connected by road. They touch one another. It would make it very difficult for them to actually impose some advisories or restrictions. And so in Alaska, one of the reasons that we had the advisory restrictions here in Alaska was, again, our health care, our limited health care. In the urban areas, we built that up. In our hub areas, we've built it up as well. But again, some of our communities in Alaska, small communities, don't have the healthcare capacity. They simply don't have it. They simply don't have the hospitals, the buildings, the doctors. And so we want to do everything we can to protect our folks, to make sure, at least in the urban areas, we get healthcare, in the hub areas, we get healthcare built up so we can bring folks in if we have to for treatment. At the same time, the considerations are society and economic activity, people's livelihoods, people's lives. And so, as one person said to me several weeks ago, will we ever get to the point where we just are no longer existing, but actually living? And so that's what we're going to be doing. We're going to, certainly when we mix, when we deal with going in and out of groups of people, we increase our risks of spreading the virus or getting the virus. And it's pretty simple. For the past several months, we've talked about, we've used all types of terms, all kinds of terms to describe what we're doing, describe the virus, describe our actions. But in the end, what we know is this virus lives in people. It moves from person to person. And mostly, the main way it moves is when somebody sneezes, laughs, sings, speaks, coughs. We project that virus out. It rides those air currents out, and if there's anyone within a certain, certain distance, it has a chance of being inhaled into our respiratory system, or potentially getting through our body through our eyes as well. And so, the way to help prevent that is, if you don't need to, stay away from people you don't know, or minimize your contact with people you don't know. We'll be having travelers come up. We're going to be asking them to take a test. When they get to Alaska, we'll be looking at their test screening. We'll be giving them advice. We'll also talk to them about self-quarantining if there's no test. We'll talk to them about if they don't feel well. And that's the other thing we as Alaskans have to remember. We're basically out of the flu season now. That doesn't mean people can't get the flu, but we're pretty much out of the flu season. So if you get a fever, you're losing your sense of smell or taste, you're just not feeling right, and you're thinking, maybe I have the virus. Maybe you do, maybe you don't. But you should talk to your healthcare specialist, your doctor, and find out if you can get tested sooner than later. And then if it comes back negative, then it's negative. If it comes back positive, you can work with your doc to see how you can deal with whether you are symptomatic or not. If you have no symptoms, we know that the incubation period is around 14 days. If you can stay away from folks, stay isolated for 14 days, that helps get rid of the virus. If you have symptoms, depends on how severe the symptoms are. Your doctor's going to recommend what you do. What we know is the vast majority of people that are infected appear not to show symptoms. That's why this thing is so insidious. You feel okay, yet you have the virus. And potentially, if you're mixing with people, you're spreading the virus. And if you're spreading it to other people that are healthy, that end up being like yourself, not showing symptoms, it really doesn't have an impact on your life. The issue becomes when that virus infects others that have underlying health conditions. Their bodies have been weakened for some reason. They're elderly. In the case of our seniors that are in some of our senior care, they're a captive audience, basically, in an environment that the only way they're going to get this illness, get this virus, is if somebody introduces it from outside the facility. So as we get back to living our lives as close to normal as possible, that's what the virus wants us to do. And I'm not saying this to make people afraid. That's the last thing I want. We understand this virus better now. And I think we can outsmart it in most cases. Some cases, we're going to have to mix with people. Nature of our work, nature of our life. We get that. But if we can keep the infection rate lower than higher, below our healthcare capacity, so it doesn't overwhelm it, we'll do all right. We'll get through this. We'll be okay, and the vaccination will come on the horizon here in a year or so, and that should help the situation. So I know there are many folks that don't want us to change our travel advisories. I know there are many folks that want to have absolutely no advisories, none at all. Again, we're a little different up here. If we were in a town or state, you see some of the smaller states on the East Coast that are very close together, densely populated, they have a lot of healthcare facilities. They have a lot of hospitals. They have a lot of doctors. Oftentimes what we have to do here in Alaska, if we have a very serious issue or there's a specialty concern, a lot of times we fly south to places like Seattle or Minneapolis to seek treatment and help. And so our healthcare capability is not quite as robust as other places. That's why we want to take extra precautions. And so when you do travel, we're asking you to take a test. If you can't take a test and you're coming back into Alaska, we're asking you to self-quarantine to stay away from other people. Now, people have asked me, they've said, well, if you're changing these advisories, are you gonna, you're gonna stick it to the people of Alaska? In other words, are you going to make sure that they are complying and they're doing exactly what you want? We got to this place where we had some of the best numbers in the country for some time because, again, Alaskans made it happen. You made it work. We're going to be putting out a robust education campaign for travelers, for tourists coming in here, so they can help us out and understand what's going on. I can't imagine that there will be tourists that would want to come to Alaska if they're not feeling well. So that's another reason to get the test before you come up, to see if you are infected. And quite frankly, if you're not feeling well, you're going to want to check with your doctor. So we have a duty, I should say, to each other to try and not impact each other with this virus if we can. The other thing is you're going to see people wearing masks, and we see what's happening in other places where those that feel strongly about wearing a mask are sometimes at odds with those that aren't wearing a mask as often, and vice versa. One of the things about Alaska that I truly appreciate, and I've always appreciated, I've said this before, you look out at Alaska, it's a beautiful state. It's amazing. But what I think the real treasure Alaska has is its people. And I said this before, I remember when I first came up here in the 80s, somebody had a car that was broken down. Somebody had a fire at their house. Somebody couldn't find their child, got lost in the neighborhood. I know other places they come together, but a lot of times other places they rely on systems and officials. But here in Alaska, there just seems to be this innate desire to want to help each other out, help each other in times of need, whether it's a natural disaster or some local issue or some issue in one's relationship or family. That's what we're going to lean on in this process. It doesn't make any sense, and it never had made any sense from a lot of our perspectives to threaten Alaskans to do something. It doesn't make it. We don't believe that works. So as we go through this process of changing the advisories, we'll hear from people saying, well, I know so-and-so, and they told you they got a test, or they showed you a certificate that they got a test, but I know they didn't get a test. We're going to have that. We know that. But we also know that it's going to be a lot of Alaskans that are going to think of our seniors, that are going to think of the lady shopping in a store who has a mask on, maybe because her child is undergoing some type of chemotherapy. We're going to think of another individual in a store that has a mask on, and we have our mask on because, quite frankly, we don't know their situation. We don't know what their health is like. We don't know what their family members are dealing with. And again, so this is the thing that's going to get us through this. If we work together, we're still going to see an increase in cases. But if we work together, it won't be that unmanageable spike that a lot of folks have predicted. This has been a very confusing, chaotic process the last several months. There is no rule book that we can follow on the coronavirus, COVID-19. I wish it existed. We'd have a lot of things solved by this point. We'd be in a lot better shape. But this isn't just an Alaskan issue. This is a worldwide issue. It's across the United States. It's across the world. There are countries in places like South America and Russia in which the cases continue to grow exponentially. I know there are some folks that believe the virus, I won't say isn't real, but since it hasn't impacted their lives, or they don't know anyone at this point that has had to deal with the virus, it's kind of out of sight, out of mind. And the requests to socially distance, and the requests to wash one's hands, and the requests to give some serious thought to wearing a mask if you're going to be in a public arena often, is sometimes met with, why do we have to do that? At the same time, I know there are folks in the state of Alaska that would like to see us have much stricter protocols over social distancing and people getting together. And I know there's a lot of folks that are greatly concerned that a change in our advisories is going to be detrimental to the state of Alaska. But again, like anything else in life, we've got to balance things. We've got to balance our society. We have to balance our relationships with people that we haven't seen. We have to balance our work. It's all has to be a balance. We've taken a lot of things for granted over the decades in this country and across the world because of things like vaccinations. We've eliminated diseases that used to just run rampant, such as smallpox. It's pretty much extinct in the world. But these are real dangers. These are real viruses. These are viruses that will make you sick. And in the case of Alaska, again, I think if we work together, we're going to minimize this growth of the virus. We'll get to a vaccination. We'll be able to vaccinate those who wish to be vaccinated. There'll be enough of us immune to this virus that this will be something that we'll read about in the history books. But that's in the future. And right now, all we have right now is the here and now. And the one thing I would ask Alaskans is that we do what we've done for months. And I don't mean hunker down all the time. I don't mean don't go to a store or open up your business. I'm not saying that. Just work together. Just think of each other. Just think, do I have to go to that meeting in person with a lot of people? If so, should I give consideration to wearing a mask so I'm not spreading it? I've never said, and the science doesn't support, that by wearing a cloth mask that you make or that you purchase prevents you from getting the virus. But there is a body of science that believes that any obstruction in front of your face is going to limit your sneezes and your coughs. I think even that's common sense for most of us. This cuts down on the spread projection-wise in the area that you're at and any people that could be there. So we're just asking folks to think about these things, work with what we know, think of others, think of yourself. And I think if we do that, Alaska is going to come out on top again. But again, we're going to be changing our travel advisory starting the evening of June 5th. There will still be communities in the state of Alaska that, because of their healthcare situation, they're going to have tighter restrictions on travel. So we all have to check with that. But again, it's all up to us. If you're not feeling good, talk to a doc, try and stay away from people. But again, I want to thank you. So with that, for details, I'm going to have Adam come up and talk about the details. And they're going to be pretty basic. Before you come to the state of Alaska, you can get a test. If it's positive, you want to go get help and not come to the state of Alaska. If it's negative, come to the state of Alaska and enjoy Alaska. If for some reason you make it to Alaska without a test, we can give you a test here in Alaska. If you don't want a test, we would ask that you self-quarantine. That's basically it. That's basically what we're looking at. And so, again, Adam will give us details here, but I want to thank Alaskans. We're going to take some questions after this, after Adams talks about some of the details. And then what we want from you is we want your feedback. If you're a traveler, if you're a business, if you're part of an entity that needs to have people coming in and out of the state of Alaska, how are these new advisories working? Our people, is it such an inconvenience that we need to take a look at something? Are there some holes in the process? And we think there will be, because again, this is the first time we're doing it. If there's some holes in the process, please bring that to our attention. And we're going to take a look at this every day, because we want to try and get this right. We want to try and do this as well, as best as we can. And we're only going to do that with your feedback and your help. So with that, I'd ask Adam to come up, just talk a little bit about some of the details, and then we will take some questions.
Thank you for that, sir. So we've got a revision here for Health Mandate 10. So this was the mandatory 14-day quarantine for those that are entering the state of Alaska. We're going to revise this, and all people coming into the state of Alaska from outside, you have to do a 14-day self-quarantine unless you fall into one of these categories. You do a pre-travel SARS-CoV-2 PCR test. So that is the virus that causes COVID-19. So this is the PCR test is what we're asking for. So this PCR test showing that you have negative results within 72 hours prior to departure, or as a traveler, you can get a test, the PCR test, showing negative results within 5 days prior to departure. And then when you arrive upon Alaska, we'll actually ask you to take another PCR test at the airport and then minimize your interactions with while you then wait for the results. So that's the pre-test option. The other option would be, if at all possible, we want you to get your test beforehand. But if you come into Alaska, and particularly Alaskans returning to the state, we're going to work to have airport testing available for PCR to make sure that is there. And we'll also give you a voucher for a second test. And this is something that you can do 7 to 14 days after the first test if it's negative. This gives you the option to go, and having 2 tests is really clear, making sure that you are virus free. So this is something that, depending on your work situation, if you've got caring for a high-risk population or family members, gives you that clear. The other option is for the Alaska residents. Alaska residents that want to leave the state of Alaska doing a short trip that is 5 days or less do not have to pre-test before leaving the state. They can leave the state and then come back into Alaska if it's within that time frame, and we'd ask them to actually take a test at the airport, or they can actually say, I'm going to self-report and go just quarantine at home and stay away from others and utilize curbside delivery, other resources. We also then have the option for critical infrastructure. For those employees that work, we're talking about fishing processing, commercial fishing, oil and gas, mining, these large congregate settings that work in remote areas. Those business plans, those community mitigation plans that they've been working under since the beginning on this, please continue to work under those. And so those individuals will be able to will be able to continue and proceed through. So how this process is going to work is we're going to have available online the declaration form. COVID-19.alaska.gov/travelers is going to have information. It should be up now or very soon. It's going to have the declaration form that you can fill out online, as well as we're working on possibly having an app so you could fill that out as well. And this is your information saying which category, which option you're going to fall into. You show this. We're going to have screeners at the airport. These are individuals that are just going to collect your information, ask this, would you like the test now, give you the voucher, either provide the test, and then we help you along your way. So we are making sure that we're helping individuals as we do this. This is how we can protect Alaskans from the virus coming into the state, making sure people are intentional about their trips to Alaska, but still giving them room to make this happen. Other things to keep in mind is the airports that we are working with directly right now are the 5 major airports that are port of entry into the state of Alaska. This is Anchorage, Fairbanks, Sitka, Juneau, and Ketchikan. For those that are on some of the milk runs, so to speak, Wrangell, Gustavus, and Petersburg, they're going to actually have testing as well for those terminus flights for individuals getting off. So we've had successful conversations with EOCs over the last week around the state, making sure they understand what's happening, working to hire screeners and contractors to provide the testing capabilities as well as the contact at each of the airports. So we're sharing this information. We're getting the infrastructure put up. We're going to have nice orange vests for everybody as a screener, so you can use them as an information resource when you come in. As individuals travel, one thing to keep in mind is you get on these flights, a lot of the airlines, Alaska Airlines, American, United, Delta, they actually all do require that passengers require masks. So do most of the airports around the United States. And so once you're in the airport and then on the airplane flying at reduced capacity, being the virus vector has actually much reduced risk. So as people come in, we ask you that you have that support with you bring your masks. As Dr. Zink said, this is the plan your trip, know before you go. This is protect Alaskans when you get here, and then just kind of watch the window of that. But hopefully we get a lot of people coming in, doing this the right way, protecting Alaskan citizens, and also give our tourism businesses a shot to have a good summer. With that, Governor, pass it off.
Thanks, Adam. So what we'll do, Jeff, is we'll take some questions and we'll answer as many of them as we possibly can. Then we'll do a closing.
Okay, we're going to start tonight in Juneau, and we'll take our first question from state government reporter Andrew Kitchenman at public radio station KTOO.
Thanks, Jeff. My question is probably for Commissioner Crum. I actually don't know. You could decide who the best person is to answer. I'm hoping for more information on how the voucher will work. Is this purely optional, or is it something that would be described as mandated? And how will people practically use the voucher? Could they take it to any testing center? And and maybe a little more explanation about why it's being why that's an element of this.
So I know it's not mandated, but for the details, we'll turn it over to Dr. Zink and Adam.
Yes, I appreciate that, Governor. So a couple of things about the details of it. So as I mentioned before, a single point in time test is not really equivalent to a quarantine. And so that's why we're asking for people for that time that they're here to really minimize their exposure to Alaskans. When you think about the time that someone would have traveled here, if they were to be exposed to the virus, any time before they traveled or during their flight, if you look at 7 days out from that and test at the end of that, you would catch about 90% of people who had been exposed to COVID-19. If you go up to 14 days, you're going to get more like 96%. The data continues to kind of fluctuate and vary. So, for example, Vermont is doing a 7-day quarantine with a test at the end versus Hawaii is doing the full 14-day quarantine with no test. There's kind of different ways to go about it. How it would happen is we give you the voucher, and then that could be used as a series of testing sites. We're working on our website right now to identify which testing sites around the state would be able to take it. The reason that we've done that window between 7 to 14 days is if you are out and about and you come back at day 11 and you're out camping before then, and that's a good time for you to get it, that would be fine. The data really shows that 7 to 14 day window, you don't get a ton of added benefit between those. If you're an Alaskan who is out of town for a bit of time with your family or doing something out of state for a while and come back in, again, really minimizing that window, same thing, voucher, and then take that test between 7 and 14 days and then kind of go back to that normal community. And the reason is because, again, that the single point in time test is not equivalent to that 14-day quarantine. So we're really trying to minimize that risk as much as possible to Alaskans while opening up as much as we can and try and move forward. So I hope that answers your question, but happy to.
Okay, we'll take our second question from Peter Siegel at the Juneau Empire.
Hi. Who is the state looking to contract with for these screening jobs?
Yeah, great question. We're going to turn it over to our logistics personnel. Heidi, are you online?
It is, yeah. So each of the communities that we have been working with, as Commissioner Crum had mentioned, working with the Community Emergency Operations Centers, is setting up the expectation about having greeters, screeners, and testing capacity at each of the airports, and that, looking at local hires and the city or an entity within the community to contract and to pay for that staffing to provide those services.
And the other question was about what kind of other contractors for Anchorage. We currently have contract with Capstone to be doing it for industry workers. We're going to be expanding that contract, and then Fairbanks, that's going to be Beacon Occupational Health and Services. That's going to be working on that as well. And so we have got this infrastructure has been in place for a couple weeks now, and now we're just going to be expanding the scope of this. And we're going to be working, as Director Hedberg said, in the smaller communities, working with local clinics or hospitals and their EOCs to make sure we're doing local hire and helping out those individuals who can help with the process both on the screening side as well as the collection side. So as we go through this, one aspect I'd like to put out there is make sure all these screeners and these individuals greeting you at the airport, these are your fellow Alaskans. They're there to do a job, to help us with this process. So, let's please continue to be kind, respectful to each other through that process. Thank you.
Let's move to Anchorage now, and we'll start with Alexis Fernandez at KTUU.
Thank you. Governor, I wanted to ask, how long will this new travel mandate be in effect for?
Yeah, great question. So we're gonna evaluate it almost on a daily basis. Remember, this virus, it's a 2-week incubation period. If you look back at our phases that we phased society back into, we were looking at two-week increments. But again, we're going to look at it every day. We're going to look at it at a weekly schedule. But really, the big benchmark time will be the 2-week period. And so we're going to keep looking at it. We're going to make some determinations. We're going to see how high our case count grows and whether that constitutes a spike or just growth that's going to be manageable. So we'll look at this every day, but you're really looking at a 2-week window.
And now let's go to Dave Goldman at KTVA.
Thanks very much. Governor, drumbeat's getting louder, certainly around Anchorage and other parts of the state. We're hearing it from people about masks, especially in places where social distancing isn't as easy. Any thoughts of making it more of a mandate to have people wear masks, essentially insisting as opposed to suggesting?
Right. So at this point, we're still relying on Alaskans like we have for months. To be able to do the right thing. Remember, a lot of this, as we mentioned, has been confusing because there was a time where there were some officials that said that masks don't matter. And then there was other times that some people were saying, well, you want to wear a mask so you don't catch the virus. So what we know today is that the cloth mask that we're talking about, it slows down your projection. But the point is, and to answer your question, right now we're not mandating it. We know that there are businesses that mandate it, and we would ask Alaskans to respect those business rules. We're asking Alaskans to give some serious consideration to wearing masks, especially when you're in a congregate area. Again, because it's really about the person next to you. You don't know them, what their physical situation may be, what their family situation may be. So we're asking folks to do this. Again, we'll evaluate everything. If we see something really going off the charts, we'll have this discussion. But right now, there is no mandate on masks, but we do ask Alaskans to give some serious consideration to it. But again, I think the big thing I would ask when it comes to masks is simply this. If you see somebody wearing a mask and you don't want to wear a mask, just give them a thumbs up. If you see somebody not wearing a mask and you're wearing a mask, they're your fellow Alaskan. And nobody's trying to hurt each other. We're all trying to do the right thing in a very difficult situation. But again, we're going to get through this together. But we'll keep an eye on this and see what happens with our case counts and our numbers. But I think what you're going to see are a number of businesses, a number of airlines, a number of settings, get-togethers in which people are going to ask others to wear masks.
Okay, thanks, Dave, for the question. Now let's go to Morgan Krakow at the Anchorage Daily News.
Yeah, thanks for taking my question. I'm curious if either Dr. Zink or Commissioner Crum, if you know how much this increased testing is expected to impact testing capacity within the state for just everyday Alaskans who aren't traveling. And then I did have a follow-up question for Governor Dunleavy. You mentioned you were talking about spikes, and I was wondering if you could just kind of define what a spike would look like and how you're sort of viewing what you would be referred to as a spike.
Yeah, I'll answer that question, then I'll turn it over to Dr. Zink and Adam. But again, we look at our metrics, and we keep an eye on our our ICU bed capacity. We take a look at what the trends would determine. So one day this week, or this past week, we had this past weekend we had a large spike in the 20s. Then it went back down, I think, to 7. It's up again today. But again, what we're going to be looking at is sustained growth in these cases that get to a point where it's problematic. Again, looking at the number of hospitalizations, looking at the number of folks that are in the ICU beds, looking at the number of folks out of, let's say, 20 that get the virus, what's our recovery amount of folks that recover from the virus. So we're going to look at all of these things. But right now, we understand that there's going to be growth in the number of cases. Again, we want to keep an eye out for that situation where it looks like it's getting uncontrollable, out of our control, that it's going to start to overwhelm the healthcare capacity. We want to look at that well before that happens. But again, we'll have Dr. Zink and Adam talk about the other part of the question.
Yeah, I appreciate the question about the testing and the impact on the overall system. Again, our number one priority is the health and well-being of Alaskans. And so we've been talking about this for some time. The testing world continues to be a place of flux. Some of the supplies are allocated federally. Some of them we're making on our own. So simply being able to make our own swabs is making a gigantic difference in being able to kind of move through with this process and think what it looks like. The reason that the 14-day quarantine is there, we are going to do our absolute best to have testing available. But if we have a huge spike in cases and we have to do a bunch of case investigations, Alaskans come first. And so that may not be able to be offered at the airport any longer. So we're working hard on that front. Alaskans are our number one priority in this Alaskan testing. We're going to be evaluating this day by day, as the governor mentioned, and week by week to see kind of what that capacity is at. But as mentioned, the testing goes for the overall state for responding to these cases as well as travel. But there's a lot of people, particularly like in the Southeast, who travel to Seattle to get their normal health care. We're trying to make sure that they can continue to travel to be able to get the health care they need, but not bring the disease back to their community. And so we see travel as a definite risk, and that's why we're putting time and effort here and testing here. So I'll hand it back over.
Jeff?
Okay, we'll take a second question from the Anchorage Daily News from Aubrey Weber.
Thank you. Does the administration know how many states or cities across the country are currently providing testing for asymptomatic people and can turn test results within 72 hours?
I don't. Dr. Zink or Adam, do you know how many states and cities are doing this?
This is a fantastic question, and we've been definitely asked that a lot here recently. The testing landscape changes all of the time, and it's hard to keep track of what's happening in the lower 48 and what is seen there. There's a national map that has testing locations where you can enter your zip code and see who around you is able to do testing. Some states clearly have a lot more access to testing, and both symptomatic and asymptomatic people can get tested. There are also at-home tests that your physician can order for you, and then you can go ahead and do that test and send it in. We are also hearing about more and more clinics that are standing up, and also talking to airports about potentially setting up testing sites at other airports as well. So I think that this is a work in progress. It's as the governor mentioned earlier, there was no playbook specifically for this. We had other pandemic plans, but COVID has proven a challenge worldwide. And so we continue to see testing move rapidly across the lower 48 and in Alaska, and continue to encourage people to keep reaching out and to look at the at-home options as well.
Okay, thanks, Doctor. That wraps up the questions for Anchorage. We're going to jump around to the Mat-Su Valley, the Kenai Peninsula, Glen Allen, and Cordoba. Let's take the first question from the Kenai Peninsula and reporter Jason Lee at KSRM Radio.
Thanks again, as always. And my question, funny enough, parallels exactly what was just asked, but kind of different. This is for, I guess, really Commissioner Crum, I would assume. In many communities across the U.S., people are only being referred to doctors for testing, if they display symptoms, which you just discussed. But is there advice that will be widely disseminated, not only to people who want to travel to Alaska, but also, cooperation with other states about allowing tests for travelers headed to Alaska as a reason for coming to get a referral, for example?
Thanks for that question. Yeah, I believe it was yesterday, we actually did a post on the Health and Social Services Facebook page that actually put up this national chart about how you can actually go to this website, put in your address, see where testing locations are. But as Dr. Zink said, we are working across the board. We've had clinics in other states and other cities that are main hubs for people traveling to Alaska step up, say, how do they be a part of this process? So we're going to continue to collect that information. We're going to share this. And as we go through this process, we're going to post this and make it as easy as possible for people to find out where these resources are at, how do they get access to them. And we've already had a couple initial conversations trying to figure out how we can work with certain states. We know that California, Texas, and Florida have very wide open testing protocols, much similar to us in Alaska, that the way they've got their drive-through pharmacy set up and open testing sites, that there's a lot of opportunity there. And we're finding more and more info from other states as well. Oklahoma seems to have quite a bit of options on that. And so we're working with these other states. We're going to try to compile information. And over the next couple days and week, we hope to have a list of stuff, a good good resource site for travelers that want to come into Alaska. And we're going to continue to work on this and put this out there. On another note, one thing we don't want to get lost through this is we are here to take care of Alaskans as well. So we are also going to make sure that we've got well-defined free testing clinics set up throughout the state. They are available, but we're going to make sure that these are easily accessible. Everybody knows, so we want it to be that if you ask your friend, like, hey, where can I go get tested? They know right away where they can go. So we're going to work on this also to make sure that Alaskans have this wide open access to testing, to make sure they're part of this process. So we're going to make sure we're keeping and protecting Alaskans. Thank you.
Thank you, Commissioner.
Thank you, Commissioner. And let's take a second question from the Kenai Peninsula from Brian Mazurik at the Peninsula Clarion.
Thanks. My question is probably for Commissioner Crum. So I'm wondering how the state is getting this information out to prospective travelers to Alaska. And I mean, is there some kind of protocol to make sure that they're not just surprised by a screener when they get off the plane?
So we'll have Adam talk about it, but we've been working with the airlines, and they're going to be putting our advisories on their websites. We have it on our website. We're going to be disseminating information. We're going to, as we mentioned in a press conference a couple of days ago, we're going to begin the process of a robust education campaign for folks coming into Alaska, but also Alaskans. You'll see flyers on some of our airlines. You'll see posters in some of the airports. But Adam, if you want to add a couple things to it.
I appreciate that. Like the governor said, we've actually had these conversations with the major airlines that are carrying passengers into the state. And so as you get online to book a ticket to Alaska, they're going to have it so it pops up saying, be aware of these restrictions and or requirements in order to fly into Alaska. It'll be a part of the check-in process. That email you get from a lot of airlines about a week in advance saying how do you prepare for your trip to Alaska. There'll be information in there as well as a link to our Alaska travel page about what are the requirements for coming in. So we're trying to make sure everybody sees this well in advance. We know that a lot of people coming to Alaska, it's a dream vacation. We love it up here as Alaskan residents. We want people to come share and see this. Just like you pack and you pre-plan what clothes you're going to bring to protect yourself up here. Just the same thing with this process. Coming into Alaska, how do we keep it safe? And this information we're going to share. We're going to continue to repopulate and make sure that our travel webpage is continually updated, and we'll be blasting social media sites. We've also had very good conversations with like Alaska Tourism Industry Association, so they understand what's going on. They can be a part of this messaging process and how they can ship information out, as well as work with member companies that they're educating potential clients coming into the state.
Okay. Thanks for that answer, Commissioner. Now let's go to Glen Allen and a question from Michelle Easty at KCAM Radio.
Hi, thank you. I'm just wondering if someone agrees to take the test at the airport, is that the rapid test, and how long will it take to get results? Also, who is paying for the test?
So Dr. Zink, you want to field that one?
Yeah, no problem. So different communities are using different tests. When we talk about the rapid test, I think a lot of people are referring to the Abbott Now, which is one of the rapid tests. The Cepheid machine is another test that could be used. Depending on the community, different tests are being used, and also depending on the person. So if someone gets off a plane and they're symptomatic and they've got a fever or chills, then we may be using a more rapid test to quickly identify it, and also depends on how far that site is away from one of our state labs. So most of the samples will be sent to one of our state labs to be run, but in the Southeast, we're going to be using some other commercial labs, as well as some things down in Washington, and the Cepheid, as well as this other test reagent. How long it's going to take to get back is going to partially depend on what airport you go to. So if you're in an airport that has rapid testing available, you may get some of that there. They may be having to send it out. It may take a couple days. We are asking people to quarantine until that test is back to see what that looks like. We are doing our best to get it back as quickly as possible, but the testing reagents and supplies are limited. It's not going to be an instant gratification test.
Thank you, Doctor. Now let's go to Margie Bauman at the Cordova Times.
I think we're all aware now, or a lot of people, that American Seafoods in Seattle is dealing with an interesting situation. They pre-tested quite a few workers that went out on one of their factory trawlers for a groundfish trip off the coast of Washington. All of these people tested negative. When the vessel returned last week, 86 of the crew tested positive. My question is, how confident are you that the tests that are going to be given at the airports in Anchorage and other Alaska airports will be effective. Thank you.
You know, Margie, as confident as we can be, that ship that you referred had protocols in place, and they caught the virus with another test when they were at sea. They were testing. They were going through this process. And so we're going to catch some. We're going to miss some. It's just the nature of this virus. It's the nature of our society and the systems we have in place. Nothing's going to be foolproof with this virus. It's going to get through a number of our flak screens, our defenses that we put up. We know that. Again, it's just trying to minimize it to keep our healthcare capacity intact until the vaccination comes. So we're as confident as we can be that we're going to be able to catch some. We also know that we're going to miss some. It's, again, just the nature of how this virus works and operates in the world we have without a vaccination.
Okay, thanks, Governor. We're now down to our final question, and it comes from Timothy Rocky at the Frontiersman.
Thank you, Jeff. With continuing peaceful protests supporting the Black Lives Matter movement in the wake of the death of George Floyd, including the one scheduled in Palmer on Saturday, are you fearful that large gatherings could increase the spread of COVID-19 and stress Alaska's healthcare capacity?
Yeah, great question. So, not to be flippant, I mean, I'm not fearful about very much, to be honest with you, Tim, but concerned that if there are folks, doesn't matter what the event is, if there are folks in close proximity, talking loudly, singing, shouting, sneezing, coughing, that increases the possibility that if somebody in that crowd has the virus, that it will be spread to others. So if folks are going to be congregating, again, we recommend, for the benefit of others, that you wear a face mask or that you stand 6 to 10 feet away from each other. That's what we recommend if you really want to do your best to try and minimize the spread of the virus, and in distancing yourself, catching the virus as well. So, again, people, just a note on this, people absolutely have the right to protest. This is America. What occurred in Minneapolis when Mr. Floyd was killed in that police action, we all know is terrible. We see a lot of protests down south. We see rioting down south. Health officials are concerned that that's going to increase the spread. And given the number of people, close proximity, the singing, the shouting, even if it was outdoors, which helps minimize it to some extent. But nonetheless, I think most health care experts believe that that is going to spread the virus. So, when we have protests or get together in Alaska, we want to just be cognizant of that, of each other. There's no reason why you can't have a protest, and also think of others as you're part of that in terms of this virus. But I want to thank Alaskans again. I can't thank Alaskans enough. While the rest of the country, many parts of it, have been roiled over this situation in which Floyd George was killed, in the manner he was killed, I don't think there's anybody that can watch that video for very long. I couldn't, and not turn away and say that was horrific. That's hugely problematic. But again, we're lucky here in Alaska. We have protests. We should be able to express ourselves. I'm proud of Alaskans that do. I'm proud of Alaskans that support free speech. I'm proud of Alaskans who may not go to the get-togethers are still in support of our free speech. And so, Tim, in answer to your question, just wrap it up, just got to be careful in whatever situation that we're in, that we think of others, that we understand that the virus jumps from one person to the next, and just be cognizant of that. So with that, again, we enter a new phase here on Friday. We're standing up our testing contractors. We're going to be helping people that come to Alaska understand what to do before they get here, understand what they do when they get here. We're going to help our own Alaskan travelers that are going to be coming in and out. We're going to try and minimize the disruptions as much as possible. This virus has disrupted everything. We're going to try and minimize that. But we're going to need your feedback from businesses, from entities, from individual Alaskans. We ask for your help. we'll beat this virus together if we work together. We will minimize the growth of this virus to the extent we can without destroying our economy, without destroying our way of life and how we interact with each other. So again, I'm proud of Alaskans across the board. I want to thank you for what you're doing. We'll keep you posted on the numbers. We'll keep you posted on the numbers and the hospitalizations and associated data. And we'll adjust if we need to, but you'll understand if we need to. You'll be part of that whole process. But again, I think Alaska is going to come out on top. I'm convinced we're going to come out of this stronger. And we just got to hang in there, work together, and we're going to be fine, Alaska. So with that, thanks and have a great day.
All right. That is what we heard statewide last night with regard to pretty significant change in Alaska policy regarding Mandate 10, which was just a flat-out 14-day quarantine if you're coming into Alaska from out of state. Now they're offering some choices there, two basic choices. Test negative, and you don't have to necessarily quarantine for 14 days. Or if you don't want to be tested, if you feel that's invasive, if you choose not to, you don't like that, you don't have to, but you will have to go through the mandatory 14-day quarantine if you can't produce a negative test result. And as far as Cordova's local expert response to that, again, we don't know. It could be that we'll find out as soon as today's daily briefings. The first one of those, remember, is at 1, and then it runs again at 5 and 8. We could end up getting a press release about it, which, we'll share. But somehow, as soon as we find out what Cordova's disposition is on this, we'll certainly let you know. Again, as I mentioned at the top of the show, there is that provision in Cordova's emergency order that they may take up to 10 days to review any significant changes to the state protocol. But with this particular one, there would be some real significant challenges to being able to inform any prospective travelers to Cordova that our situation is different. And I don't know at this point whether our local experts will determine that that's just going to be too complicated with this one, and we're going to drive people nuts if they get on a plane thinking the rules are one way and then they step off the plane and, oh, surprise, the rules are different here. So we'll have to see what they decide. Now, even though we're still a ways from seeing our first ferry, I thought we might, since travel is the subject of the show today, share this news from AMHS in which they talk about increasing their COVID-19 mitigation protocols. They say that in order to protect the health and safety of our customers and employees, the Alaska Marine Highway System is implementing enhanced COVID-19 mitigation protocols at all AMHS facilities and aboard all vessels. These protocols include reminders to passengers and AMHS employees to practice good hygiene and follow social distancing guidelines. The wearing of a face covering is strongly recommended. Next point, passenger capacity on each vessel has been reduced to 1/3 to promulgate social distancing. Because of the limited seating capacity, vessels may fill up and non-ticketed passengers could be turned away. Customers are encouraged to book travel in advance at ferryalaska.com or by calling the reservations center. Next point, passengers will complete a health screening form before boarding. People who are sick or have recently had contact with an infected person will not be permitted to travel. Next point, the CDC COVID-19 prevention guidance will be posted on the AMHS website, at the terminals, and aboard the vessels. Next point, modifications to food service spaces will be made to ensure social distancing. And final point, intensified cleaning of all areas, including routine cleaning of frequently touched surfaces. They go on to say a COVID-19 information page, including a copy of the passenger screening form, will be added to the AMHS website. Before planning a trip, AMHS customers are encouraged to review this information and the CDC's Consideration for Travelers webpage. And so with that, we will bring to close another edition of the Town Meeting Talk Show. Glad you could join us. If you missed anything, if you want to hear it again, if you want to share it with somebody, the show will soon be archived at youtube.com/Cordova TV, an entity created by our very own third-generation broadcaster, Robbie Lewis, who said, Dad, we got to get with the times and make our stuff available on the internet. And I said, hey, you know that better than me. Do it. Later on, we'll have our daily briefings. Could possibly have some more information on the Cordova's expert response to the changes to the travel mandate. Possibly we'll learn if we're just going to follow the state precisely or if there's going to be any sort of a pause to consider things more carefully, if that's even allowed. So 1 p.m., 5 p.m., and 8 p.m. for those, and they will also be archived on the website. And like I said, I'm hoping to, if we don't get it done today, in the very near future, at least by tomorrow, I'm hoping, actually, there's a chance we might have Dr. Sanders on the talk show tomorrow to discuss our local doctor's reaction to this stuff about out-of-state travel. So we'll see how that goes. The best laid plans still have to be fluid in 2020, so that's that's this darn year. Thanks for listening. Big thanks to Cordova Wireless Communications for the sponsorship. All of the 10 a.m. hour programming to which you are entitled will be coming up for you next, and we'll look forward to seeing you for the next Town Meeting Talk Show when it occurs on KLAM.